All was quiet in a field hospital on the Eastern Front. And then suddenly it wasn't like that. A wounded man arrived. It was a seriously wounded Ukrainian soldier. An enemy mortar had fallen nearby and he had shrapnel wounds. Within seconds, a medical team was at work. Children's drawings with patriotic messages, "Glory to Ukraine," hung on the wall. The unconscious patient was taken to the operating table. He looked more dead than alive. Doctors performed an emergency blood and plasma transfusion. A paramedic cut his uniform. Another bandaged his left leg. The third gave him an injection of fentanyl. A powerful pain. A heart monitor beeped. Outside, the steady pounding of departing Ukrainian artillery could be heard. The front line where the Russians were located was 5 kilometers away. After 20 minutes, the injured man's condition became stable. He started moaning, a good sign. The paramedics bent him up and placed him back on the stretcher. The soldier was wrapped in a gold foil blanket. He was taken by ambulance from the makeshift medical center to a fully equipped hospital. It was a dangerous journey. Russian troops frequently shell the muddy road that winds between drooping sunflower fields and half-abandoned villages. He had lost too much blood. Another 30 minutes and he would have been dead, said Dr. Denis Sholom, head of the medical team. In fact, he added, he will probably live now. The stability point is enough for soldiers suffering serious battle wounds to be treated at later stages. The doctor added, we save 98% of our patients. Sholom said most of the cases he saw in a conflict characterized by brutal and terrifying artillery. Ardment on both sides were caused by shrapnel. He said wounded soldiers usually arrived in the early hours, brought from the trenches under cover of darkness. Dr. Sholom says he and a surgeon will continue to work while the S are falling. He added that Russians often target his ground floor clinic. Sholom, a 37-year-old pediatric anesthesiologist, said he and a surgeon continued working when the S fell while their colleagues hid in the basement. I worry about them, he admitted, adding, sometimes we have to do amputations. If we have the slightest chance of saving a limb, we send them somewhere else for treatment. The location of the hospital cannot be disclosed for security reasons. Nearby is Bakhmut. In May, Russian forces occupied the city in the eastern Donbas region after a crushing year-long siege. Russian forces are trying to advance along a 600-mile front in the east and south of the country. Further north, in Kharkiv province, they move towards Kupiansk and the Oskil River. Every day they open fire from the forest canopy, initiating conflicts and attacks. In October, Russia launched its largest and most ambitious attack in months. At least 3 brigades launched a surprise dawn attack on Avdiivka, a Ukrainian-held frontline town near the occupied city of Donetsk. It included tanks, armored vehi,